Quick reality check. Heart disease is the leading cause of death in women in the United States, and yet just about half of us really recognize it as our number one health threat. So if you've been treating heart health as a someday topic, you're not being irresponsible. You've actually been trained to think in those terms. Today we're talking about 3 midlife signs that may not be associated with heart disease, but could be an indication that your heart needs more support. It's not just chest pain. Welcome to Healthy Her Midlife, the podcast for women who want real, natural solutions to feel strong, calm, and confident in their bodies again. I'm Christine Roberson, a certified nutrition consultant and health coach. Let's dive in. All right, ladies, welcome back to Healthy Her Midlife. It is February 2026 if you are watching or listening to this episode live, and February is American Heart Month. And before we deep dive into heart health, there has been some talk and research about hot flashes being associated with higher risk of cardiovascular disease, especially when those hot flashes are frequent and severe. Now, the research points out that hot flashes are not a cause of heart disease or cardiovascular disease, but it does mean possibly that severe hot flashes are a signal, a warning sign to future heart disease related events like higher blood pressure, insulin resistance, and even less favorable cholesterol levels. So if you are dealing with really severe and frequent hot flashes, then I don't want to scare anybody with this, but this is something that might want to give you a heads up as far as your heart health risk factors go. And again, it's not that these hot flashes are causing heart disease, it's that they usually coincide with somebody who may struggle with heart disease in the future. So the first sign that your heart might need more support now in your midlife years is that your stress tolerance has tanked. You used to roll with all the things, but now you are stressed out, you're crying, you're overwhelmed, and you're irritable, or you're feeling wired and tired. Or maybe it's after a stressful day, it just takes you longer to recover. But what you need to know about stress is it's not in your head, it's in your nervous system. And that matters because high blood pressure is a real risk factor for heart disease. And the menopausal transition that we all go through, it causes more in our bodies than hot flashes and brain fog. It also triggers higher blood pressure and changes in our lipid profiles. And this is why our go-to just push through it method of dealing with stress no longer works. And the result of this is that something like maybe after a long day at work, you come home completely exhausted. It's 7:00 at night and you can't relax. And instead you are flipping through your TV channels, or you're scrolling through your phone and you are doom scrolling and snacking at the same time. Or it could be why you're waking up at 3 a.m. with your brain trying to go through all the day's events for that day and the day to come. So if this sounds like you, it will be really important for you to really manage your stress levels and to find productive ways to offload that stress. It could be going for walks. It could be deep mindful breathing exercises, maybe yoga or even meditation. Simply reading a book, getting your brain to relax and get away from whatever stressful event has triggered it. You can even try some breathing technique that I like, and it's inhaling for a count of 4 and exhaling for a count of 6, and doing that for about 5 times in a row. This type of breathing pattern signals to your brain and your body that you are safe and you can relax. The second sign that your heart health may need more support these days in midlife years is that your energy levels are crashing by default. If you're waking up tired, or you're having mid-afternoon crashes, or you just feel really exhausted due to just normal life, these are signs that your energy levels are way off and you need some more support. So the reason for these types of energy crashes and severe fatigue are manyfold. It could be a lack of sleep. It could be an iron deficiency. It could be a thyroid disorder. It could be a whole host of things, including stress. So this is definitely worth bringing up to your doctor. But aside from something really biologically wrong happening or a severe deficiency, what I commonly see in midlife women with this type of energy crash and fatigue level is underfueling your body in the mornings, leading to unstable blood sugar levels, which leads to cravings later, and that leads to poor sleep. And then we repeat that cycle again the next day. This could look like maybe you are just having a cup of coffee for breakfast and a salad for lunch. And then by 7 o'clock in the evening, you are standing at your kitchen pantry door and throwing anything that you can into your mouth. Or it could be that you are eating healthy, but you're not getting enough protein or fiber into your daily diet to support your body right now. If this sounds like you and you're dealing with a lot of fatigue and you've already seen your doctor and there's nothing physically wrong with you, then I would recommend that you start with your breakfast and make sure you're getting a serving of protein and a serving of fiber in your breakfast every day. So what I recommend is about 25 grams of protein in the morning for breakfast. And then for fiber, throughout the day, you want to get a minimum of 25 grams of fiber, but you can definitely go even higher on fiber. So maybe try to hit as close to 10 grams of fiber in your breakfast as well. So what does this look like? It could be a yogurt parfait. I make a soy yogurt parfait for my breakfast every morning. That includes just 1 scoop of protein powder, about a cup of mixed berries, as well as some flaxseed and hemp seeds and oats. And my yogurt parfait has about 30 grams of protein in it and pretty close to 10 grams of fiber. I'll have to double check on that and I'll let you know. But if you're interested in a good yogurt parfait recipe, check out my website, healthyhermidlife.com, and hit the recipe section. And under breakfast, I do have a yogurt parfait breakfast recipe. Tell me in the comments, are you having an energy crash in the morning or at night? The third sign that your heart may need more support right now is that you are ignoring symptoms like they don't matter. They just may not look dramatic to you. We were taught that a serious heart event looks like a man clutching his chest. But in reality, women experience heart events much differently than men do. Some of the signs are shortness of breath, nausea or vomiting, back or jaw pain, unusual fatigue, and sometimes these come alongside with a little bit of chest discomfort, but not always. This isn't meant to make you anxious, it's meant to make you informed. If something in your body feels new, uncomfortable, or just not right, please don't ignore that. Please see your doctor immediately. And if you've been brushing off symptoms for months, time to make the phone call to see the doctor. And it may be worth having a conversation with your doctor if you do experience consistent and severe hot flashes, because more and more research is showing that that type of hot flash is a sign that something could be either wrong with your heart health or about to be wrong with your heart health. It's simply your body asking for some help right now. So here is your 7-day heart health plan. This is a simple, supportive plan that you can easily get in 7 days. Really easy. Number 1, take a 10-minute walk after just one meal most days of the week. Number 2, 1 fiber add-on daily. That could be a banana as a snack or an apple as a snack. It could be extra flax seed in your oatmeal or in your yogurt, or it could be extra oats, or it could be a generous scoop of beans on your salad. And number 3, do 1 stress relieving activity per day. Try the 4-6 breathing that I talked about before. Try doing a yoga class or even desk yoga. You can do a 10-minute desk yoga at work and you'll feel so much better afterwards, I promise. These things are not a big transformation, but they are a signal to your body that you are taking care of yourself. And if you've listened or watched this video and thought, you know what, I need a more personalized plan to help reduce my stress or improve my energy levels, then consider a wellness call with me. It's totally free. And together we'll look at what your challenges are and what fits your lifestyle best. If you're interested in that, it is over at my website at healthyhermidlife.com/coaching. And while you're there, check out my free Midlife Metabolic Reset Guide. It is full of tips and advice to help improve your metabolism as well as your energy levels. And that is available at healthyhermidlife.com/reset. All right, ladies, I hope you enjoyed this episode, and let me know in the comments what your biggest concerns are with heart health. If you enjoyed this episode and found it helpful, please consider liking the video and following the channel on your favorite podcast app and sharing it with all of your amazing girlfriends. It really does help me grow. Thank you for joining me today, and I'll see you next week on Healthy Her Midlife. Thanks for spending time with me on Healthy Her Midlife. If today's episode spoke to you, download your free Midlife Metabolic Reset Guide or book a coaching call at healthyhermidlife.com. See you next time.